depending on your location. Once again, welcome to Garden of Fertility. I'm still your fertility counselor, Opera Stella Thelma. I'm a medical lab scientist by profession. To my new subscribers and my regular viewers, I say thank you for being part of this family. I really appreciate you all for motivating me more to go more further, to do more research on fertility. And by the grace of God, our medical options are working out for people, both online and offline. Many people are testifying, are getting their results through this channel. So I am highly encouraged to do more, to go further, to make more research on possible solutions, how to overcome this menace of infertility in our society today. This have been a havoc. It have wrecked a lot of family, which some people know and some may not know because they don't have such experience or they don't know people that are experiencing such. So infertility have caused a lot of hatred, not just hatred, but have caused a conflict between many families. Yes, between many families. So that's why we are here, to help you, to bring to your knowledge, to give you the proper orientation. There are many alternatives. There are many alternatives to achieve this parenthood. When you have tried the normal method, the natural way you know how to do, and it's not working out, you need the help of a fertility counselor to help you, to give you the proper orientation to make a rightful choice. It is possible, no matter what you are passing through, other people, some persons have passed through that and they have overcome it. So your own case can be different. So today we are going to be talking about sexual transmitted disease. Sexual transmitted disease and how it affects fertility. Sexual transmitted disease. Sexual transmitted disease is one of the overlooked and one of the most ignored aspects of treatment when it comes to fertility. And these sexual transmitted diseases have caused a lot of havoc and damages in the body unknowingly, because some of them doesn't show any symptoms. Some can stay in your body for years without you knowing that you have such challenge or have such bacteria, fungi in your body or virus in your body. It can stay so long without you knowing. And this can only be noticed or maybe find out through series of tests, diagnostic tests, before you can know that such a thing is in your body or such a thing have already damaged a lot of things in your body. So we are going to be treating that issue of sexually transmitted disease today. What is sexual transmitted disease? A sexual transmitted disease is an infection that is being transmitted through sexual intercourse from an infected person or animal. Yes, you can contact it from an infected somebody. When somebody is infected with gonorrhea, or any type of sexually transmitted disease, and he or she is your sexual partner, the tendency that is transmittable to you is there, because mainly it's being transmitted sexually. We have different types of sexually transmitted disease. We have number one, gonorrhea. We have chlamydia. We have syphilis. We have candidiasis. We have AIDS, acquired immune deficiency syndrome. We have genital herpes, and many of them, to mention but few. So we are going to handle each and every one of them one by one today. The first we have on our list here is gonorrhea. The first we have on our list is gonorrhea. So I'm going to be looking down on my books because I jot many so important points I have to disclose to us today, so that we are going to get it serially, we get it in order. So, how does this gonorrhea present itself in a man? Because you as a man or a woman may be seeing different types of symptoms in your body, but you may not understand why it is so. Before any sickness can erupt from the body, there must be a sign. But negligence to this sign can cause a lot of damage in the future. So now we are going to be talking about how does this gonorrhea present itself in a man. In a man, we are going to be treating the male and the female at the same time. So for you that is watching me outside there, now, the way it appears, the way it presents itself in a man, number one, the male will notice that he will be having pains while urination. Anytime you are urinating as a man and you are feeling pains during this urination, after urination, there is a sign, it's a signal that something is wrong. It can be a sign of gonorrhea in your body. And that will make you to seek medical attention. You need urgent attention. So I said number one, painful urination. And number two, I have in my list, he said, whitish discharge will be coming out from the mouth of your penis. Mouth of your penis, the whiteful discharge will be coming out from there. This whiteful discharge can normally, if you are okay, it cannot come out. But when you are being infected with this gonorrhea, you will be having whitish discharge from your body. You will be having whitish discharge from your what? From your body. Number three, this could be associated with fever. You may be having fever. This infection may be associated with fever, yes. After treating malaria, typhoid, you keep on having fever. You understand? So when you begin to see something, you have done the necessary things you're supposed to do, and it's not working out, and it's still repeating itself, you need to go and check yourself. You need to go and check whether you have sexual transmitted disease. And lastly, the male should present himself to a qualified doctor whenever he notices any of these symptoms in the body. As a man, when you notice these three signs in your body, I said number one, painful urination. Two, whitish discharge at the mouth of your penis. And three, you know you have treated malaria, typhoid, you are still feeling feverish, because this infection can come in form of that. When you have done these three things and the symptom persists, My dear, you need to meet your doctor. For proper diagnosis, you need to meet your fertility counselor. You need to meet your lab scientist to know the root cause of this, the sign you are seeing. Why is this so? Over to the women's side. The women aspect, there will be, number one, you'll be seeing a vaginal discharge which have a foul smelling. Which have a foul smelling. You will see a discharge in your body. And this discharge is not normal. We know we have a normal discharge and we have abnormal discharge. When you have a normal discharge, you don't need to perceive any odor. And when the discharge is not normal, it will be having a foul smell. It will be smelling. Even when you remove your pants, you'll be feeling, you'll be perceiving it yourself. So when you start perceiving smell and discharge in your body as a woman, that is symptom of gonorrhea in your body. Number two, when you start having pains during sexual intercourse, you have sexual intercourse and you feel pains always. This is a sign of sexually what? Transmitted disease. Example of it is gonorrhea. So don't take it for granted. Don't take it for granted. Don't ignore that sign. If you notice that while having sexual intercourse, you feel pains, that you need proper examination. Number three, it could be associated with fever. It will be associated with fever. So when you start seeing feverish condition in your body after you have treated malaria, typhoid, and many of them, and you keep on seeing that sign, that means you need to go for proper check. Something is wrong. Another one, number four, is pains, the abdominal pains. Having abdominal pains. When you have abdominal pains, something is wrong there. Something is wrong. So don't take it for granted. And finally, is bleeding after sexual intercourse. Some persons bleed after sexual intercourse. It may be minor. It may be heavy. It depends. So whenever you have all the signs in your body, please, I encourage you, don't keep it to yourself. Visit your doctor, visit your fertility counselor, visit your lab scientist for proper diagnosis. With these few things I've mentioned here today, if you know you are seeing these symptoms in your body, please, you need a medical attention. You do what? You need a medical attention. Finally, I want to discuss on how to prevent this gonorrhea in a man and women. If you're a man, if you're a woman, this gonorrhea is preventable. How are you going to prevent this sexually transmitted disease? In my list here, I have number one is avoid multiple sexual partners. Multiple sex partners. Avoid it at all costs. Because you can have 4 sexual partners now. One, you don't know the one that infected you with this sickness. Because you are being advised while treating yourself, your partner also supposed to be taking the same drug. Because if you go back to your partner after treating yourself, the tendency that the sickness will come back is there. The tendency is what is there. So that is why while treating yourself, you also treat your partner. You have to bring your partner to your lab scientist, to your doctor, to your fertility counselor. He needs to be counseled as well because he needs the same treatment. So avoid multiple sexual partner. It can easily spread. Can you imagine when a woman have a gonorrhea and you have 4 boyfriends at a go, 4, And in this 4 boyfriend, you can transmit this disease in 4 of them. So how the danger there is that if 4 of them are so, they will still have other friends. They will still be spreading it outside there. They will spread. They will have other friends. As the thing is spreading, you see it now. So, but you yourself, you can curtail it. When you have one session, if you treat yourself, you treat your partner, you see yourself getting free from this infection. Number 2, avoiding sex, abstaining yourself. If you can't stay, we encourage you not to have multiple partner, please. At least have one person. Abstinence is another way to keep away from this gonorrhea. And number 3, do not sex with an infected person. I love girls, I love women that are very wise, and also men. Before they have anything to do with you, first, you go and check yourself. You check your whether you have sexual transmitted disease, whether you have HIV virus, before they can be able to do anything skin to skin with you. Yes, some men do it. So I encourage you to be wise to that extent, please. And also, urinate and wash with warm water after sexual intercourse. After sexual intercourse, you urinate, you wash yourself very well. You wash your body very well. Wash your body, cleanse it very well with enough water. Yes. And also have here, report infection to your doctor. Don't keep it to yourself. Many a times, some persons are too shy to disclose their ailment to their doctor. If you're hiding yourself to your doctor, you are killing yourself. If you are seeing all the symptoms, you speak out. You speak out. Tell your doctor. I believe in medical profession there is an oath of allegiance there. You don't disclose people ailments. You don't disclose people's sickness to others. That is the rule that is guiding the law that is guiding the medical profession. Without the person's permission, I don't think you have the right to disclose it to any other person, even a close relatives, even a close what? Relative. Now, finally, after the treatment, see the doctor for checkup. After the treatment, you see the doctor for what? Checkup. After the treatment, you see the doctor for what? Checkup. After the treatment, you make sure you see your doctor for what? For checkup. Now, we are done with gonorrhea. We are done with gonorrhea. We are done with gonorrhea. We are going to be talking about syphilis now, on how to handle syphilis. This syphilis is also a sexually transmitted infection. This is another deadly sexual transmitted disease caused by a tiny plasmodium. That's what we call plasmodium. Yes. It is caused by palladium. Yes. Palladium. Palladium. Palladium is the name of the virus or the name of the ailment that causes syphilis. Now, in male, this syphilis appears the way it presents itself in a man. Number 1, there will be a painless sore in the mouth of the penis, which may disappear after some weeks. There will be a painless sore, it will disappear, it will appear, and it will disappear. Now we also have inflamed eye. You have inflamed eye fever and many more of them. There are many symptoms that comes up with this. They sore appear and disappear. And in female, there will be a sore and rashes in the labium major of the woman. That is in the private parts. There will be a sore. You'll be having a sore in your private. That means you have syphilis. You have it. And also you have loss of appetite, loss of hair, and sore throat, inflamed eye, fever that will disappear and come back in some weeks. These are the symptoms you see as a woman. So when you start seeing this kind of symptoms in your body, what are you going to do? What are you going to do? When you start seeing swelling in your groins, there is a problem. There is an infection that need urgent attention. That need urgent attention. That need urgent attention. Now, the problem of the syphilis in men. Sperm producing cells are destroyed. The sperm that produce, how it affects fertility. The sperm that produce, the cells that produce sperm are totally destroyed. Not just destroyed, there is what we call infertility in men. It causes infertility in male. When your sperm cells are destroyed, what next? Nothing can be done when the sperm cells are being destroyed. And number two, the brain cell become damaged. You know, this issue of sexual, anything sexually has to do with the brain, connection with the brain. The brain, when somebody touch you now in your sensitive part, in the sensitive part of your body, it will signal to the brain. Now, when the brain is damaged and somebody is touching you, maybe in your breast, in your penis, and the signal is not is connecting, it will you feel so bored and as if nothing is happening. So when the brain cell is destroyed, you know what is at stake. You know it's at stake, yeah. Now we have here is that there is what we call depression. Depression, there'll be a depression all over. You feel depressed when your brain cells are damaged. Feel when you don't feel sexually aroused, low libido as a result of this virus, as a result of this infection, not virus, as a result of this infection, sexually transmitted infection. Now, in female, this can result to infertility. It can make a woman not to get pregnant unless this was properly treated. Now, it can cause loss of pregnancy. In my subsequent videos, you will see where I will discuss more on how this syphilis affects pregnant women. It can make a child to go blind. It can affect the child. It can cause autism, a lot of things in the born child. This can also cause a conjoined twin, to have a conjoined twin together. So my advice to you is today to see your doctor. If you are seeing this kind of symptoms in your body, see your what? See your doctor. Stop having sex until you are fully what? Treated. Stop having sexual intercourse until you are fully what? Treated. Stop having sexual intercourse until you're fully what? Treated. Avoid crude method or self-medication. Some people assume, yes, I now have infection, and when I take chlorophenicol, when I take this. No, don't assume it. Visit your fertility counselor, your medical doctor, your lab scientist. So that is it. Sorry for the shortcomings because of the network. We are back again. We are back. Thank you for watching. So we are talking about what to do when it comes to medical advice, when it comes to this syphilis. I said, see your doctor. Don't have sex until you are properly what? Treated. And finally, I said, use condom if you can't wait. If you can't wait, if you can't abstain for that moment until you're properly treated, please protect yourself. Both male and female should go for lab tests and receive treatment. Accordingly, the man, the woman need to go for this check and receive the same treatment. Yes, this is not what you will say because the man is seeing her own physical symptom, you're not seeing your own, and you said, no, no. You too, you need, because in subsequent time, your own symptoms will do what? Will sprout out. Your own symptom will come out. So you still need it. Both of you need to be treated. Now, we have mentioned gonorrhea, we have mentioned syphilis. Now, we are going to be talking about vaginal discharge. Vaginal what? Discharge. Yes. Now, vaginal discharge is a liquid section produced in the vagina when it is being infected by microorganisms. It begins to have offensive odor and stain the clothes. Vaginal discharge, we have normal and abnormal discharge. So when you begin to have abnormal discharge, abnormal discharge used to have a foul smell, odor, and it will be staining your undies, it will be staining your pants always. So that's when you will notice when you have abnormal discharge. Normal discharge, you feel free, you don't perceive any smell from your body. So when you begin to perceive smell as a woman in your body, something is wrong. Something is wrong. Natural vaginal discharge has no infection. How do you know the and natural discharge that is infected and the one that is not infected? Now, discharge that has no infection. Number one, it has no smell. It has no odor. Number two, it does not pour much in case of infection. It does not stain you. It does not pour, as in once in a while you see something will pouring out of your body. At least if you are menstruating, something is coming out. It will just stain your pants. It does not irritate. When it is normal, it does not irritate you. In most cases, it does not accompany with pain. Many a times, this discharge comes with pain, but this one, when it is normal, there is no pain. Now, we also have, it does not itch you. It doesn't itch you. Abnormal discharge comes with itching many a times. But when it is normal, you don't feel any itching in your body. It may not go with blood. Many abnormal discharge come with blood. That is stain. Little blood coming out from your vagina. So how do you know that your discharge is infected? Number one is you will be having a foul smell odor from your vagina. You'll be having the smell. It'll be smelling. Number two, it is much in quantity. The things that will come out, it will be much in quantity, unlike when it is normal. When you put pad or pant, you will always see stain, always. You will always see stain. It will be staining it, and it will also be smelling. Now, it also irritates and cause a lot of inconveniences for women. It always do what? Irritates. It will keep on irritating you. From your body, it will keep on irritating you. Because when your pants stain, you feel uncomfortable and the rest of them. It will go with itching. It can at times blood present. There will be a blood present in the discharge. Blood present, it may come with itching. It can cause depression and restlessness in female. It can cause depression, restlessness, because you may be feeling, maybe when you go out to visit somebody, or in case your boyfriend or the rest of them, or your husband, you may be feeling uncomfortable because of the kind of smell you may be perceiving. You'll be perceiving it, and your partner will also be perceiving it. You need a medical attention. What is the cause of this vaginal discharge? I'll read from what I have here. I said, through sexual intercourse with a sufferer of sexual transmitted disease. When you have sexual intercourse with a carrier, somebody that is being infected, you can easily contact it. I encourage you not to live carelessly. Don't live your life, especially as a woman. Don't. And you also encourage your partner. Don't live it carelessly. Be sensitive about your health. Take care of your health first. Monitor your body system. Know your body system. Whenever you start seeing change in your body, you know something is wrong. So it brings about the discharge of milkish color liquid, which cause itching and burning sensation in female. This itching and foul smell doesn't end there, because it can go further inside the body and block your fallopian and cause scary tissue that can block the fallopian tube. Unknowing to you, it can stay there for years. Maybe during the time of reproduction, you go to hospital, they say you have a blocked fallopian tube. You may not know it, maybe as a result of sexual transmitted disease you have 5 years or 10 years ago, that have stayed there for so long and cause scar tissue in the tubes and block the fallopian tubes. That is why you don't need to take it for granted. To treat fallopian tube is not an easy it's not an easy case. Many a times it can lead to surgery. Many a times the only possible option there is in vitro infertilization, that is IVF. When you have blocked fallopian tube, it takes the grace of God to come out from that. So avoid it at all costs. Avoid it at all costs. Signs which a woman could know that another one we are going to talk about is what? Candidiasis. Candidiasis. There are some signs a female will see. You know that you have candidiasis. Discharge from the vagina is milkish in color. You begin to have a milkish discharge in color in your body. So how can you know that you have this candidiasis? A lot of women, I can remember when I was in secondary school, because we normally use public toilet then. So whenever I come back, I don't really know, but this itching normally comes up, and my mother keep on monitoring me. He said, no, my daughter, this is not normal. I have to take you to lab. I have to take you. I was thinking it's just a May something, but I didn't know that it's a serious case. It was even now I'm even realizing that, thank God for that. Assuming I don't have somebody that have knowledge around me, this thing could have stayed in the body. You think it's just and it keep on proceeding to damage a lot of things in your body in the future. So even if you don't have anybody around you to encourage you, I'm encouraging you today. If you are seeing those symptoms in your body, please run for your dear life. Go and treat your candidiasis. Treat it. It's a fungal disease. It can easily be treated. Only it will take you a little time, but it is treatable. No, there is itching inside and around your vagina. If you're having itching, watching me here live today, if you're having itching in your body, please don't take it for granted. Please don't take it for granted, because the harm it will cause for you in future is more than the good. Not just some people may be having this itching, they keep on using canesten cream, all those cream to rub on your body. Please Don't, I will not encourage anyone to treat him or herself. If you are having itching with self-medication, they will tell you, if you take this herbal drug, please, everything will go. Yes, it's possible, it's true, it can handle it. But make sure you go for a proper diagnosis. Let the proper antibiotic be ministered to you. It's like somebody that is throwing stone. You have a direction you want to throw your stone, and you are scattering the stone. You throw here, you throw there, you throw there, but you have not gotten your target. You have a focus. Why you go for this high vaginal swab? The test is called HVS, and it's called high vaginal swab. When you go for the sensitivity test will dictate exactly the antibiotic that is needed to handle that particular fungi or virus or bacteria or parasite in your body. If it is resistant, it will show there the one you are not supposed to take and the one that's supposed to handle that bacteria and give you a better result. That is why you should avoid self-medication. And when you treat it finish, when you after taking your drugs, you can go on and take any other herbal, any other thing you feel like you want to take to cleanse your body. It's your choice. But make sure you handle it properly. You handle it well. Because when you handle it well, it will not go on to harm you or cause other problems in your body. When you have this candidiasis, you have increase in discharge. You'll be discharging, which may require high putting on piece of toilet roll, pad. You will see as if you are under menstruation. It will be coming out. Whitish discharge will be coming out of your body. As if you are menstruating, but you are not. So that's why you need, if you see all the symptoms, you need urgent attention. The area where the hairs grown in the female vagina are called labium majora. Become reddened. It will be red. Or vagina, those places the hair grows, that place will be very reddish in color. And when it is reddish in color, you know what it takes. You can't be comfortable as a woman. There is this kind of itching that comes with this candidiasis. You'll be itching, it will be very sweet. It will be very sweet for you. But that sweetness does not, some people we try to have a private place to have more time to scratch it well. Please, you don't deserve that. You don't deserve that. You need to see your lab scientist today. You need to see your lab scientist today. Even if you have gone for such tests and you don't still understand, please, you can chat us. You can see my number on the comment section. You can chat me one-on-one. I can explain it to you and also counsel you on what to do. Even if you didn't go for the right test, I will encourage you. I will tell you the right test you need to do to overcome that menace, to overcome that ailment. And another thing, sign that come with this candidiasis is when you make love with your partner, you feel pain that is unbearable. The pains, you feel pains. Some people will scratch themselves to the extent they will have wounds in their body. And this wound, when you make love with it, and some of these scratches, when you scratch it, when you remove your hand, it will start paining you. Talk of when you make love with it. It is very painful. It is very, very painful. And also the odor that associates with this is also terrible, which you may not be comfortable. Seeing yourself smelling your pants, the kind of odor that will be coming out of you will not be comfortable with it. Even sometimes you'll be walking on the road, you'll be perceiving it yourself. You're perceiving the smell. When you sweat, you perceive it. No matter how you use perf to perf yourself, your physical body, but the inside, inside is smelling. It's smelling. So it's terrible, please. I don't encourage anybody. Even if you are living with your children, your med, check them. So another one is stain. It's also stain your pants, and you become restless. It makes you to be restless. So today I want to encourage, if you're a woman here watching me live on this section, please, you have your maid, you have your grown-up children. Please don't just leave them like that. Check them always. This sexually transmitted disease, many at times, especially candida, can be contacted through the toilet, infection from the toilet. Yeah. So especially children, your children that are in boarding school, whenever they come back, try to check them, monitor them, monitor their look into their this thing. I told you all when I was in secondary school, I went to a boarding school. Anytime I come back, you see how my mother will be monitoring me as if, in fact, to an extent I get uncomfortable about it. She keep on monitoring as in every movement. If I scratch my hair, you say, what is inside that hair? If I scratch it, you say, no, something is wrong. Me, myself, I never knew that I've contacted it in my toilet. We have a public toilet there. But she insisted, no. To an extent, after treating it, I will go back to boarding school. When I was tender, the sickness will still come back again. When I come back, I will be scratching. My mom said, no, she can't continue with this. I have to change my daughter from this school. That's how I left the school I was in then, to go and enroll me in another school. Because he said he can't see the reason why after treating me, I'll still go back and still contact the same candidiasis. That she can't continue like that. So, and the school management are not ready to do anything concerning their toilet system. You know, sometimes our body differs. Persons can pass through that process, they may not contact anything. Some persons, they will go eat, even common touching, going closer to that place, they will start having allergic reaction in their body. So our body system differs. That is why you need to be sensitive about your body system. Monitor it very well. Know your limit. Know your limit. Know your limit. Monitor your children. The ones around you, don't take any sign for granted. See your doctor. Visit your fertility counselor. Visit your lab scientist for proper diagnosis. Or you can schedule an online counseling with us. One-on-one counseling, we call you, we talk with you. Even in your location, wherever you are, we can tell you what to do. You can still get the same results. Yes. You can still get your what? Your results. And you will also be treated. But our major concern is for you to do it rightly. When you do it right, you get the right results. Now, how does this sexually transmitted disease affect fertility? As I've said it here before now, sexually transmitted disease can cause harm. It can make a man or a woman not to get pregnant if it's not properly treated. If it's not properly treated, it can cause infertility in man or in women. There is one other sexually transmitted disease we didn't handle here, chlamydia. This chlamydia is also a very terrible one. This chlamydia is also a terrible one. But this chlamydia is one of sexually transmitted disease. It can't show any symptoms. It can't give you any symptoms in your body. It can be there for so long. It can stay in your body for so long without any sign. And not just without sign, it will go further to cause scare on your fallopian tube, leading to pelvic inflammatory disease. From there, the tubes will become blocked. And when these tubes are blocked, what are we going to do? When your tubes are blocked, what are you going to do? Many people have taken a lot of herbal drugs. If you take this one, your tubes will open. If you take that one, your tubes will open. My dear, it's 50-50. Prevention is better than cure. Start on time to prevent it. Start on time to prevent it. Some people need to have lead to surgery. In a situation, it leads to cutting their fallopian tubes, but still nothing is happening. I here today encourage, especially women that have blocked fallopian. If you have tried, it's not working, please go for IVF. Go for IVF. Stop waiting. Stop taking different. They'll tell you this one. If you drink this, my dear, stop it. If you have tried enough. If your tubes are blocked, go for IVF. With prayer and faith and readiness, there are some things you need to prepare yourself. You need to get ready. When you get ready for that, you see it working out. You need to be positive about it. Sorry. You need to be positive about it. Sexual transmitted disease can cause, I didn't mention staph cells. Staph is one of them. Staphylococcus aureus, yes, it's one of them. This staphylococcus can make a man impotent. It can make a man impotent. There will be no erection. That is why you don't need to. If you see any sign, my dear, my brother, my sister, run for your dear life. Every sickness is treatable. Every sickness is preventable. If you suspect any reaction in your body, or you have a sexual intercourse with somebody you suspected that may have the infection, immediately run to the available close medical or lab to check yourself and start treating yourself instantly. Don't wait until you start seeing signs or everything begin to change or everything begin to. No. Start on time. Start on time. Sexual transmitted disease is treatable. It's avoidable if you can avoid sex partner. If you can be faithful to your partner, you don't have any case with sexual transmitted disease. You don't have case with sexual transmitted what? Disease. How are you going to do all these things without medical guide? You need somebody to guide you. You need somebody. You may be good in other things. There are people that are good, that are expert in this profession. They can guide you. They can tell you what to do to get your results without delay. Without delay. Sexual transmitted disease have kept some people barren because they delayed the medical attention they're supposed to go. There was delay on it. But assuming there was no delay, there was urgency in their medical attention. This menace could have been curtailed, could have been maneuvered. But now, sexual transmitted disease have led to scar tissue. From scar tissue, it have blocked fallopian tube. From fallopian tube, proceeding to cause other problem, or it have caused damage in the testicle to the extent there will be no erection. It will destroy your brain cells to the extent you will not even get signal. Even somebody touch you, you may not have any feeling for your partner. So don't hide any sickness. You man, you woman outside, don't hide it. Even if you can hide it for anybody, don't hide it for your doctor. Don't hide it for your fertility counselor. Don't hide it for your lab scientist. When you say it out, it is possible. You see yourself coming out successfully, giving your testimony. Infertility, sexual transmitted disease can cause it. Sexually transmitted disease can cause delay in your journey to parenthood. Your journey to parenthood, it can cause it. So, but one thing you have to bear in mind is that one thing, if you have not learned anything today, one thing you have learned today from this channel is seek medical attention on time. Seek medical attention on time. Delay to medical attention can be very costly. It can be expensive. It can cause a serious trauma in the future, which will lead to irreplaceable damages in the body. So that is it. I don't know whether we have any question here. We just have few minutes to end this section. We have 2 minutes to end this section. I don't know whether you have any question to ask. We are here to reply you. If you have any question to ask, we are here to reply you. We are going to reply you. If you have any question to ask about sexual transmitted disease, if you're having sexual transmitted disease in your body and you are seeing any symptoms, please, we are here to answer that question. No matter how long this infection have been in the body, it can be treated to an extent. Yes, it can be treated. It is treatable. It is treatable if you can be patient. It may take time, but it is treatable. The only one I know that it is not treatable, I know it can be maintained, is human acquired immune deficiency syndrome. That is HIV. Yes. With antiretroviral drugs, you can maintain it, but it cannot go. It cannot go. It cannot finish. The virus will also come out. When it matured in the nodules, it will still come out. It will still infect the blood. But with the antiretroviral drug, it will reduce the viral load in your body. It will reduce the viral load. And I'm encouraging you, if you're outside there, you have this virus, please don't be a part. Don't be a partaker in spreading of this virus. It can be wickedness. You know you have this virus in your body, and you still went further to transmit it to another person without protecting yourself. And you have vowed to make sure that everybody we contact this sickness. Everybody will die the same time. It may not work that way, please. Don't be a party to that. Don't be part of it, please. Don't even encourage that at all. Don't encourage it. Don't encourage it, please. You can still find love. You can still find somebody that will love you with it. Modern technology today have made it possible. A husband and wife can be in a house, but the wife may not have it. But they'll be producing children without the virus. Yes. If you are taking your drugs, you can have sexual intercourse. There is a way they do it. You will not infect your wife. Even your children will not carry this virus. By the help of God and prayer, you see yourself sustaining, living with it without stress, than going about spreading it. The most painful part of it that some persons are also infecting little children, infecting children that are coming up. When you go to hospital today, you will see percentage of children that are having this virus. Many were being molested, many were being raped. So please don't be a part in that menace. Don't be a part of it, please. Don't be a part. God will help you if you believe. I've seen people that have this, when you see them, you won't even know. They look clean, they look healthy. You see them living freshly good life. But when you start meandering, living a life of wickedness, the end of that person is very near. Please don't be a part to that. Don't be a partaker to that, please. And finally, I want also to talk about this. There are many of them. There are many of them. Sexually transmitted disease. Oh, I mentioned a few. We have genital warts and the rest of them. And this sexually transmitted disease can not only be transmitted through sexual intercourse. There are many other ways it can be transmitted. There are many other ways you can transmit it. So let not just focus our mind it's only on sexual intercourse you can get the virus. No. You can have it to skin contact when you have a wound in your body. When there is fresh wound in your body and somebody that have it, you also have a fresh wound. By contacting with that open sore or wound or blood, it can still be infected. There are many other ways. But in whichever way, please, any way you can prevent it to make sure that it didn't spread, it didn't affect other people, please, let it die and end there. Don't be part of it. Don't be part of that wickedness. Okay? So I'm waiting for questions. If you have questions, you can drop in the comment section. We are here to answer you. We are here to reply you. If you have any question concerning sexual transmitted disease, if you are passing through, all the symptoms we have mentioned here, if you are having any symptoms in your body, it's high time you speak up. It's not what you keep to yourself. Sexual transmitted disease is treatable, but when you delay it, it can cause more harm than good. When you delay it, when you delay the treatment, we have a better treatment options. Yes. So don't assume it. Don't go for self-medication. Don't keep on taking herbal drugs. Say, this one, if you see, yes, it may work for me, it may work for other people. But I've said it before now. If you know you have it, please go and meet a lab scientist. And when you meet a lab scientist after the diagnosis, he will give you the right antibiotic that will handle that infection. After that, you can go ahead and take your herbal drugs. After you have done this first, you can go ahead and take any herbal drug you wish. Yes, it's a license. I permit you to, but first of all, handle it. Go for check. After the check, there will be antibiotic to minister to you. After the antibiotics, you can now proceed to any other thing you want to do. So we only have 5 minutes to end this section. If you have any other question to ask about sexual transmitted disease, I can also answer you here. we are still waiting. If you have any question to ask, we are here to answer you. We're here to answer you. If you want to know more about this, we have a book. You can read through it. You can go through it. Our ebooks, you can read through them. When you go through them, you will see the possible remedies. In that our ebooks, we have some drugs we recommend for people there. We recommend you and how you need to go if you're having this sexual transmitted disease. And you are being encouraged, if you are treating yourself, you also treat your partner. Treat your sexual partner. If you're a couple, treat your wife as you're treating yourself. Don't say it's me alone that I'm having. Your wife has been infected too. So far, you people have unprotected sexual intercourse every day. The tendency that the woman is also infected is there. So if you are taking any drugs to treat yourself, also include your wife in that journey to get a better result. To get a better result, yes. Yes, if you have any other question to ask, we are here. If you have any other question to ask, if you have any question to ask, we are here to answer you. If you have any question to ask, we are here to answer you, okay? If you have any other question to ask, we are here to answer you. So we have many of our patients, some of our patients waiting for us outside there to attend to them for today. So if you're having any form of infertility, anyhow it appears, anyhow it shows yourself, you need somebody to guide you. You need somebody to advise you. You need somebody to tell you options. There are options people don't even know that is existing. If they know that those things are existing, they will not even be crying. They will not kill themselves. They will try those options. I've said it before now. If IUI is not working, IVF is working. If it's not working, ICSI is working. If it's not working, surrogate mother is there. We have surrogates. In a situation, your egg will be harvested, the sperm of your husband will be collected and being fertilized and inserted into another person. And he will carry the baby for 9 months and he will deliver and carry your baby. She will deliver and you carry your baby. And nothing changed. The DNA, everything is yours. It's your baby, it's your blood. It's your blood. So if you have idea of all those things, you see it, that it is possible. You don't need to keep yourself so waiting. Try something. No matter how you get into this journey of parenthood, it's a miracle. It baffles me sometimes when I see some men, they will say, let's go and check the DNA of their child. You know your thing is not working. You know you're having erection problem. You know you have low sperm count. You have weak erection. And you're not ready to do anything. And you know your thing is not working. And you have the gust to come out, to go and examine, say, this is not my child. You will not tell them that you are not effective, that you are not healthy as a man. So I believe this thing is a thing of cooperation. You have to cooperate with your wife. Even if it's not working, you go for sperm donation, which you know very well that it is your fault. Not tomorrow you will come out and be blaming your wife. That your wife, that the children is not your, the DNA is why you are having azoospermia. You don't have sperm cell at all. So let's stop that at this present age. It's not anybody's fault. It's not your fault, neither her fault. But what we are looking for, possible remedy, solution to come out of that barrenness, to come out of that childlessness. Yes. And she's here there to help you. So that is it. So if you have any other question, you can drop it on the comments section. We are going to reply you. We are going to reply you because we have so many other people to attend to offline. Very soon, I'll be showing you some of our products we have here. These are natural products. Yes. Especially the one we have here is so, especially women who are having dryness, who does not enjoy sex. Women that don't enjoy sex at all. They have dryness, the man is dry, no urge. So when you take it, you see yourself recuperating. You see yourself delivering. You see yourself having that urge, having that passion to stay with your wife. So that is it. So we are going to end this section here. Thank you for being part of this family. Thank you for watching. I really appreciate you. By this time tomorrow, we are going to come live to discuss one or two things again, because we are going to be going live for now. We have many things to dish, many things. So stick to this channel. Stick to this channel. Thank you for watching. Thank you for being part of us, part of this family section this afternoon. I really appreciate. Thank you. Bye.